All right, I'm going to give folks just a few more seconds to join, and then I'll go ahead and kick us off. Okay. Well, everyone, welcome. My name is Shannon Roberts. I'm a program manager with the Peer Recovery Center of Excellence. Hi, Lindsay. Welcome back. Always good to see you. All
Sorry.
right. All good. All good. So in this month's session of our program evaluation and research learning exchanges, we have Allison Kelly with us to talk to us about culturally relevant and community-based evaluation. Allison Kelly is an evaluation scientist with interests in building communities' capacities to address the cultural, social, and environmental factors that contribute to differences in health. As a reminder, we try not to make these overly formal, so please put stuff in the chat if you want to introduce yourselves. If you want to connect in the chat, network, I'll be in the chat answering any questions. And if you have any questions for Allison throughout the presentation, you can either throw it in the chat, come off mute, let us know what's going on. And I know Allison has a really great presentation for us. And she also has I don't know if you're familiar with Kahoot, but that's always exciting. Makes me feel like I'm playing Jeopardy. Um, and then before the end of the week, I'll send out the recording. I'll send out all the resources that Allison shares throughout the presentation, including her slides. And then also in the name of the value evaluation, we'll also have a survey about this session. It'll let us know how we're doing and how we can be better with our programming and event scheduling in the future. And I think that's it. I will make sure to throw links to our future sessions in the chat. And with that, I'll hand it over to Allison.
Well, thank you, Shannon, and thank you all for being here and for all of you that are on camera. It's always easier to be in these spaces if we can see other people. And so thank you for that. I'm glad that you're here. And thank you, Shannon, for inviting me. I was really, it's always nice to be included or invited to things, and I haven't been with you all before, so this is exciting. I live in Sisters, Oregon. I don't know if we have any folks from the West Coast in the house, but it's a beautiful day here and just a lot of good stuff happening. So I'm gonna just do a slide share to get us going, but I see that some of you have put your names and your organizations in the chat box. And I'd love to hear where some of you are from, or like where you're calling in from. So it looks like Latanya has a daughter that went to OSU. Oh, in Corvallis. How cool. Well, that's not very far away. That's great. Go Beavers. It's a great school there. So do that if you have the time. Again, this is super informal. I only like to do work that's meaningful and fun. And sometimes these webinars kind of push the limits of not having fun. So I'm going to try to make it as good as I can here. So let me just do a quick slideshow of a couple of things that Shannon wanted me to talk or share with you here. Okay. So Shannon, can you see my screen okay? Is it
I am seeing the presenter's view.
Oh, okay. And I think that, and actually that's okay. Let's see, swap it. How about now?
There we go. Perfect.
Yeah, the screens go crazy when you click that button. Hopefully I can get out of it. Okay. Well, I wanted to talk today a little bit about finding value in healing spaces. And when I use the word value, typically I'm talking about evaluation. And when I talk about healing, I'm talking about recovery. I like those two words better than evaluation and recovery a lot of times because they're more meaningful to me. but we all have different ways and different words that we use to call things and experiences. So don't get hung up on that. This is a disclaimer that I'm not going to read. And it is important to destigmatize addiction, and those words do matter. If you need a TA request, Shannon's your person. And some housekeeping notes that I did not write. Okay, but the agenda. So my agenda, and we all come with an agenda, right? Like for everything that we do. And I want to have fun today. I want you all to have some fun. I'd like to learn a little bit about, or I'd like you to learn about how to find value in the work that you're doing. We will look at some examples and models. These are important because we learn from what we've done and what others have done about what works and what doesn't. And then we're going to actually practice some evaluations. So I will need one of you to volunteer. And then we'll spend a little bit of time kind of reflecting on what all this means and where to go next. And, you know, I read this statistic the other day and automatically I'm into like researcher mode of like, is it really 9%? Like, how did they get that? And this is from the NSDA survey from 2023. But 9% of the population is in recovery. And that's a huge number. And that's something to really celebrate. And I don't know if many of you are in recovery. I am in recovery, and it's just a great time in my life and in the world. There's just a lot of good stuff happening. And with that, I'm going to end the Kahoot here, or end this slideshow, and we're going to play a game. And Shannon kind of likened it to Jeopardy. You know, my students have not said that about Kahoot, but actually it's kind of like that. So there's a little bit we need to do to get the Kahoot kind of set up. So if you have an iPhone, I kind of find that this works better with an iPhone, but you can also use it with your computer. So we're going to go to kahoot.it. Actually, let me just share my screen real quick. Here we go. So you've got to go to this website. It's kind of weird, but you go to www.kahoot.it and you type that into your browser and your phone. And then it's going to ask you for a game pin. And I promise this will be fun, or I think it will be. So we have one person already that's joined. Sage, thank you so much. And I have no idea how they come up with these little characters, but they're always really cute and they're expressive. So it's like, anyway, so Dr. Joe, Cher, and you don't have to use your name. You can use somebody else's name. We have D-Man. So it's nice to have like at least 80% of the group playing. Otherwise, well, it's just like not as fun because you don't get as many responses, and then you're just looking at us play the game and you're not playing and you're like, why am I even here? So keep on coming in. If you're having any challenges with getting into the Kahoot, let me know. I might be able to help you. And then I'm just going to look at who's in the room in the chat box. So we have people from everywhere. New York, Iowa. We have Juneau, Alaska in the house. That is so wonderful, Stephanie. That is amazing. Alaska is so beautiful. So Illinois, Kansas, Duluth. So thank you all for being here. And we have 13 players. So I say we get going. The good thing about Kahoot is if you're still trying to figure it out, you can join later just by typing in this pin. And I don't know, Shannon, if we want to put that information in the chat box, but that's always helpful if people come in late. And we're going to get going. So get ready for some fun. I don't know if you guys can hear the music, but it's always kind of nice, like Jeopardy. Okay, where do you live? So you're going to take your cursor or mouse and put a pin on this beautiful map. And as you put your pins, we will begin to see where folks are at. And you only have like 30 seconds to answer these. And so don't miss out on the fun. Okay. Wow, I love it. So we have folks in the room from all over, lots of Midwest folks, and New York, East, Texas, Alaska, California. So thank you all for being here and showing up. I know that well, sometimes these kinds of things are not exactly exciting. So, but hopefully you came here with a reason. You're here because you want to know something, and maybe we can help you figure out what that looks like. So, and this one is locked. I don't know why. Let's go to the next one. So I think evaluation is, and select one response. Is evaluation very difficult or very easy in your experience or your current capacity?
A representative will be with you shortly. To make account changes or pay an invoice.
Okay, let's see how people responded. Okay, so folks are kind of in the middle. Okay, 54% say it's not really that difficult, but it's not that easy. So that's good. We've got some skills here, so that's exciting. And then this is another kind of interesting fact. People with more financial resources and milder addictions are more likely to recover. Is that true or false? And this would be based on kind of like the universe of literature. So maybe not in your, where you work, but in the world of knowing. Okay. So this is surprising. 7 people said false and 5 people said true. And it's actually true. But this is where we get to hear from you all. So for folks that said that's false, I want to hear from somebody that said that that's not true or that's false. So does anybody want to volunteer?
I will. I said it because I was thinking about how many people get treatment or medications for opioid use disorder. So I was thinking it was low.
Okay.
Does that make any sense? I don't know.
Opioid disorder that have a lot of money are less likely to recover, or that because they have money, they're more likely to get MAT or access to meds that will help them? I mean, it's really, if you've seen that, I think that's definitely can be true,
Well, I live in conservative northern Arizona, and you'd be hard pressed to find there's one OTP in our entire county.
No.
Sorry.
Oh, I'm sorry, Linda. So there's one OT in your entire county.
Correct.
Wow.
But it doesn't matter how much money you have.
Yeah. Yeah, that's a good point. Anybody else? It looks like Scott raised his hand. What do you think, Scott?
I put true. Just it seems like financial resources or lack of financial resources can be a barrier for people, whether it's like that can coincide with educational things, that can coincide with transportation, food, a lot of things like that, and milder addictions. I feel like addiction kind of, as it progresses, it really in that, whether you look at like the Jelinek curve or whatever it's called, like when dishonesty and denial become even more progressive, it's can be harder to get out of or to
Mm,
build the tools to come out. That's just personal opinion.
yeah, no, that's definitely, I think, important insight to share. And I guess the point of this slide is to think about equity. And one of the things I found, and I know from my work, and we do work throughout the country in recovery and healing spaces, but this idea that if recovery is not equitable, like if you have more financial resources, if you have better access, like Linda was saying, then you are more likely to get the support that you need to recover. And, and that's changing. I think things are becoming more equitable, but there's definitely still work that needs to be done. And Lindsay, it looks like you raised your hand. We'd love to hear from you.
Yeah, so I work a lot with like the OSAR, which is a referral and screening, right? And so people who will wait for a bed for public funding for like treatment for months and months and months. If you've got money, you can get in anywhere at any time.
Yeah. Yeah. Well, thank you for sharing those experiences. I mean, that's definitely something that we need to be aware of. And it looks like John said resources are resources, money equals access. So absolutely. And we can talk more about this as we go along today, but I think it's an important frame as we consider how to evaluate and find value in what's happening in recovery spaces. Okay, and just to look at our scoreboard, it looks like Tanya is leading and Laura is close behind. So keep it up. Good work. And we've just got 7 questions. So this is another fact, might be different based on your experience, but people with an illicit drug or alcohol disorder do not seek treatment most of the time because they don't feel like they need it. And there was more to that sentence I wanted to add, but there was a limit on the number of characters we could put in Kahoot. So really, this is talking about why people do not seek treatment. And yeah, so the majority of you agreed and said 7, and that's true. And when I think about this, I think it's interesting because if we are a person that with illicit use, drug use or alcohol use disorder, and we don't feel like we need treatment, then if we are in a recovery or healing space and we're trying to help those people in some way, it makes for an interesting relationship. And we know from a lot of the recovery spaces that we work in that the majority of our participants are court ordered to be there, or they're there because they have to be. And so it just makes the process, I think, different. And it's an important consideration when we're evaluating maybe what works and what doesn't work and for whom. So just something to keep in mind. Does anybody want to share their response to this, or maybe their experience of what they've seen in working in these spaces? Maybe you've had a different experience. It looks like Dan has his hand raised.
Yeah, I think I knew and sought out treatment several times. And I guess I felt like I knew I needed it. But I was maybe just too stubborn to accept it. So that's why I answered false.
Yeah, no, that's really important. So you knew that you needed it, but it just maybe didn't work the way that it needed to until now. I mean, obviously you're here and probably doing a lot of great work, but and that also gets, I think, to just readiness and where people are at on the recovery healing continuum. So
Yeah, and I mean that's an interesting point too. I mean, it's tough to generalize in the work that we're doing. We're seeing that people's pathway to recovery are as diverse as the people that are here. So I'm not sure there's one correct answer. I don't know.
Yeah, well, and I love that you bring that up, because that is like the ultimate challenge. Being a researcher, an evaluator, and even an author is like we have to put things in boxes, right? We have to count. I mean, SAMHSA, NISDA, they do a survey, they put out this data. I mean, we're always, when we're finding value, we're always trying to quantify it in some way. And you can't a lot of times with recovery and healing. So I think that's a really important limitation. And people with the lived experience of healing and recovery have that insight, that humility and knowing. But I think people sometimes in, federal agencies or on the outside of things that don't have those experiences might not appreciate that as much. So that's really important to bring that into the discussion. And I don't know why these are locked. This is so weird. I didn't test this survey before I put it out there, but I'm gonna put this in the chat, and I would love for you all to share, or even out loud without typing, what is one thing you want to know about evaluation today, and that will help me kind of think about how we spend the next 25 minutes. So type your responses in the chat, or let me know kind of what you're hoping to get out of today. And then the podium for the Kahoot has a winner here, which is exciting. We're all winners, but some of us kind of rose to the top. It looks like it's Sage is the winner. All right. And then we have some runners up. So good job. Thanks for playing that game. And I will turn off the Kahoot with the music. And we will keep on moving forward. So I'm looking at the responses about what you want to know. And it looks like, what is better for evaluation and recovery, qualitative or quantitative instruments? Okay, what are good program metrics to see if your program is successful? Okay, wow, these are really good questions. I don't know if I can answer them all. Well, I mean, I could, but maybe not today. So let's get kind of looking at the slide deck, because we like to look at slides, but I hope I can answer some of these questions, and when I was going to school, I remember one of my, professors or whatever, his answer was always, it depends. And I think with the qualitative, quantitative question, it depends, but I really like qualitative data. It's just a little bit trickier to analyze. And then a lot of questions about evaluation tools. And yeah, just keep on going. And then Shannon, maybe we could download all of those so that we make sure we address them with anything we're sending back out. Because I want this to be useful. Otherwise, what's the point of even doing it? So let's get back to kind of some slides to look at. So we played the Kahoot. Any feedback on the Kahoot? Have you all played it before? You like it? Dan's shaking his head no. Farrell liked it.
No, I liked it. I was shaking my head and said no, I hadn't heard of it.
Well, it's more fun when it works. I don't know why some of that, some of those okay, so that was our first part of having fun. And let me just see if I can get this slide deck to work. Okay, so Shannon, are you looking at the Kahoot slide or the presenter mode?
Kahoot slide.
Love it. Okay, so it worked. Okay, so I don't know where to begin with this. I thought about today, and of course, I've been in this space of thinking about value for about 20 years. And so there's lots of different ways to approach evaluation. And this is a model that's in a treatment program evaluation book I wrote. And the book is called Treatment Program Evaluation, but really it's Recovery Program Evaluation too. But the idea is that as evaluators and people working to really find value and meaning in what's happening, is that we never really stop assessing kind of what's happening. And it always begins with kind of a question like, what is the problem, or what do we need to address, or what are we doing, and then what's causing this. And this is really important if, for example, we have a recovery client organization we work with, and they're the number of people who actually successfully complete outpatient treatment and stay in recovery for 6 months or longer is like 3%, So, that's kind of a problem, like, to us, right? Because we want to be making sure that they know how to support people the best ways in their healing. And so then we start thinking about causes. Well, why is it that only 3% of those folks can find healing? And a lot of it goes back to where they live, their environment, poverty, not having support, things that you all know probably way more than I do. And then, like, okay, well, if they don't have housing, how can we create a tiny house community, sober homes for folks, jobs? And then, how are we going to do that? And then we're evaluating that. So the goal is that it's very much like a process, and it can change. It's living. It's not just one thing. So you all might know this if you've been working in evaluation, or if you have ideas about evaluation, but these are the steps that a lot of times we follow. We actually wrote some stuff on logic models and a theory of hope rather than a theory of change. Logic models, and we'll have some examples that I can share with you, are based on a theory of change. So what you think will happen because of what you're doing in a certain space. And the other thing that's really important about these steps is the critical evaluation question. And a lot of evaluators and folks don't ever think about that. And so I would love to hear from any of you that are working to evaluate programs or wanting to. Is there one like burning question you have? Like if you went to a wizard and they said, Scott, you can ask me one question about what's happening that is going to just solve the world's problems for infinity. Like, what would that question be? The question and then finding the answer. It's hard to get at one, but even one or two, and I don't mean to pick on you, Scott, you're just in the middle of the screen. But anybody, like, this burning question you have.
I mean, this stuff's been on my mind. I've been in a peer recovery specialist at the outpatient addictions program in the organization I'm with, and I come from a business background too. Like I was in contract administration before this, and so we trying to find like meaningful metrics that show like somewhat objectively like how are we doing. Right now, I don't think we do much of that. So I'm sure some of the stuff is subjective, what's happening, or like a little bit more qualitative, but I do feel like there are meaningful objectives and ways to help shape your program's practices and for accountability and checking in to kind of stay the course and see how your changes are actually working. But we haven't quite got to that point as a program yet. So I don't know if that's something, just like what are meaningful metrics even in the outpatient world? I mean, what do you say is success?
U.S. Senator
I mean,
Dick Durbin. Our office is
Yeah, no, that's really helpful. So you want to know, your burning question is, it's kind of like, are we doing a good job? Or like, what do people think about what's happening? Um, and so you're wanting really to evaluate your services as a peer recovery support specialist or within the organization? Is that what I'm
Yeah,
hearing?
even within the whole, I mean, I would think on a peer level somewhat, but on the greater scale too of our whole like addictions program. It's not a super huge program, but just have a little bit more structure on what, you know, metrics look like for us to hit, to just be able to more objectively story tell like how we're doing using data in a way that makes sense.
And we haven't got to the case example yet, but you might be our volunteer because I want to know more about the metrics. So like when people come to a meeting or they have a meeting with a peer support specialist, do you all count all of that and like put it into some sort of electronic health record or system?
Yeah. Yeah, we use CareLogic with our organization, and like I would enter in encounters for the different people that I would meet with or have the encounters with. So yeah, there'd be ways to pull some reporting out of it, but I don't think we necessarily have like data analysts or things like that in our system versus like where like I worked in a healthcare organization or like a hospital system and kind of more with the project manager. We had data people. We were kind of putting like yearly goals together, kind of, and being able to sort of track like, you know, that's a different world, but I feel like there's meaningful application for that in this world too, where you don't have to spend a ton of time with the administration of it, but just doing something that you check in on periodically. Um, whether that's like how many people are completing our program completely and putting in how many hours and um, you know how many, like what's our UA rates or like whatever, like finding ways of actually like tracking accountability a little bit more throughout ways like counselors are kind of busy doing their interactions with people and managing on a small level, but at some of the higher level, just kind of thermometer checks on how things are doing and accountability, not necessarily are in place right now. So
Okay. I'm taking notes. Yeah, that sounds like an important question that you all have. So that's like really what you want to focus on. There's some tools we can share, some ideas I have about that. But Lindsay, I know you've had your hand up. So what are your thoughts?
I think that one of the things that we did at the organization that I was in was we switched to a software platform that would track everything for us. That was very comprehensive for those measures, which was nice because the one we had before that, we were trying to pull all the different reports and it was a pain, right? So getting a good system in. My other thought is that, I'm part of a work, like a team that is looking at the SAMHSA's creating, for healthcare, for physical healthcare, they have a system that's national so that all the medical records can be transferred. They're creating one for behavioral health and mental health right now. SAMHSA's working on it. So I'm interested to see what they will come up with for their measures, because I know that like I've worked under grants from SAMHSA that was all completely focused on like, oh, well, how many, people are in recovery means you have to be abstinent. So how long have you been abstinent? And I'm hoping to get away from that a little bit.
Yeah. No, I hear you. I mean, these are good stories and it makes me think about, also like, and I love SAMHSA because they fund a lot of our work. So if anybody from SAMHSA is on the call, like, thank you for being here. Thank you for everything. But so we, the GIPRA drives everything, right? So we have these work, even with our, every program, it's a GIPRA. So we're counting everything, right? And we're trying to get follow-ups to count more things, and then we get a rate and we're compared. And so like the story of recovery or like what's helping people gets kind of lost. And a lot of times with even electronic health records or systems where you're putting information into a computer screen like the one we're looking at, but it never comes out and it never means anything. That's really common because a lot of times programs don't have like that final person, like a data analyst or a researcher or somebody that's closing that loop. So then it kind of always gets to like, why are we even doing this? And I really kind of think it's collect data and not use it. So I don't know where that leaves us, but I have some evaluation plans. An evaluation plan is kind of a nice tool that evaluators use to kind of outline the whole process, these steps. But I mean, it's just a paper unless you actually use it. But it can be helpful. So I can share that as well. Let me see what else we have in this slide deck. We can come back to that in our case example. I want to make sure I leave time for that. But, you know, the other thing I started to think about when putting this together was kind of like who's in these healing spaces, who would have data that we could use, who could we share data with about healing, like that they would want to know and do something with it. Because I think a lot of times when you work in recovery and healing spaces, it can feel like, I mean, you have all these people around you and these different systems, but it's kind of like, well, do they care? Or like, how can we work together? It can feel kind of like you're alone. So just recognizing that there are all these different spaces and people and organizations working, I think is really important. They're collecting data too. So a lot of times we don't always have to collect primary data. If you can get some good partnerships, data sharing agreements, whatever you have within your space, that can really help and also lessen the data collection burden on the participant. One of the biggest things that we see is like data quality and survey fatigue. So folks are just tired of being surveyed and evaluated and, you know, like they just want to go out and live, right, and have a good time and in a healthy way. So I think we can be mindful of that and find other spaces to collect data and improve kind of what's happening. You know, the other approach, I think, and this is kind of like big picture because we only have like an hour and we had to spend 20 minutes playing Kahoot. So I don't know how much we can get through, but, you know, systems approaches to evaluation work. And they work because you're looking at before and after. And if you kind of ignore, this is based on a treatment program approach, but there's text about healing program approaches. I mean, it's very much the same. You look at where you were at back then and where you're at now, or where you want to be in the future. And that's really the recovery story, right? It's like moving people along that continuum and what's happening, what's going into that narrative, and then what's coming out. And then always using those stories to just make things better. So I think that process, that holistic approach really works. And I'm going to stop sharing my screen because I want to do a case example. Let me just get through all of these and end the show, end slideshow. And I'll check the chat. So, okay, I need for my logic model. Yeah, we can, you know, and the thing about it is like, if there's something that you really need, there's lots of questions that we didn't get to, send me an email because like some people want to know about how to design instruments and reliability and validity. And I mean, those are all really good questions. So I'd be happy to talk about that after the call, or I mean, you know, if we have time, we can talk about it now. But who wants to, do we have a volunteer in the room? And this is going to require you to kind of be vulnerable. So let me know who wants to volunteer. If anybody wants to volunteer. Because I want to walk through a case examples, what I call it. So when I'm teaching, I like to use lots of case studies because, I mean, who wants to read about something in a book or something I'm saying. I want to hear what you all are saying, what you're living. Okay, Latanya has raised her hand. Okay, Latanya, does that mean that you'll be a volunteer?
Yes.
Okay, okay. So I want to walk through I want to know about you and what you're doing, kind of why you showed up today. And I want to walk you through an evaluation process. And I'm going to take some notes. And I'm going to plug it into the holistic evaluation circle. And I don't know that when we started talking today, I put a PDF in the chat that kind of outlines all of this stuff and then additional narrative about what is with some resources. So if you get bored during this because you're not the volunteer, feel free to check that out. Oh, Lindsay wants me to put it in the chat again.
Yeah, I don't see it.
Sure. Let me
Allison, I can do that if you want to keep chatting.
okay.
I
Sure.
can grab the PDF.
Okay, cool. Okay, so Latanya, let me see. Oh, good. And you have your video on. Yay. Okay, so first of all, tell me a little bit about what you're doing, Latanya. Like, where do you work? What do you?
Okay, so I work for Pure Voices of Merced County and Pure Voices of Orange County. We are a statewide organization. I'm under their fiscal sponsorship. I provide one-on-one peer counseling as well as group counseling, support group facilitation. I also do advocacy work. So I've been working on several of the bills, the mental health bills California has going at the moment. I also do harm reduction advocacy as well as a bunch of things around housing. And I think that's it. Yeah.
Okay. And what exactly do you want to know about evaluation?
So I am writing a logic model theory of change because I'm the equity grounded leadership program. And I would like to know more about the thing I want to know more about is how to evaluate client employee success when you have a client employee that is in active use. So I would like to know how would I measure their metrics, it's people still, they're still doing a good job, you know what I mean? So would I put, this person is in active use, they come to work every week, every day, they're doing their job, did I measure that as a regular employee or as an employee that uses substances? And how would that work for grants?
Okay, and so let me just see if I got this right. So you want to measure, you want to look, so you have somebody on your team who is actively using substances. Is that right?
Not yet, but we're about to hire. And since I do harm reduction work also, I want to hire the grant that we have, we can hire, people that are in active use. So, but the app that we have right now, it doesn't measure that.
Okay, so you'd create some questions around that.
Right.
Collecting data from the participants or the harm reduction staff member,
Right.
or both.
Right. Okay.
So I guess there were a couple things, and I'm visual, so I'll just pull things up. If we looked at our model from before, and hopefully you can see, are you seeing the circle?
Yeah, I see it.
So the problem, or whatever, I don't want to say problem sounds kind of negative, but you're wanting to, you don't know what's going to happen when you match a client with somebody that's a staff member who's actively using. That's kind of what you're thinking about.
Right.
Okay.
Right.
So, and then what is the cause, or are you thinking in the back of your mind that something different will happen because it's somebody who's actively using? Like, what is?
No, because I think that there will be well, not better success, but I want to show the success that, because people that are in active use can still work, you know what I mean? They still can provide peer recovery service. They can still provide peer services. And I want to show that success metric. Like, hey, this person, they didn't come to work high, but they still use, and their success is great because they're able to help people in this area more, kind of thing like that.
Yeah. No, I like that. I think there's a couple of different models. I don't know if the holistic model would work for this, but
Hmm.
I mean, you mentioned early on like a logic model. I can share this one with you. We have a bunch of different ones we use, but this would be for the entire, like your harm reduction program or what you're wanting, what you're doing overall.
Okay.
It wouldn't be just for that really narrow focused question you have about client success.
Okay.
But this, I can share this with you.
I
Okay,
like that.
so then the other thing I would want to know is like, and I'm like putting my evaluator researcher hat on. So what does the literature say about people working in harm reduction settings who are actively using? Are there things like unexpected benefits or things that other researchers or people have found about that you should be thinking about or measuring?
Yeah, there's people that the people that are in active use that do peer recovery work, people that their clients are more apt to seek treatment. They're more apt to come to support groups. They're more apt to be in community to want to get help.
So they're better off, is what you're saying.
Yeah, so far the research that we have through NHRC is showing that people are getting better recovery so far.
Okay, wow, that's really encouraging. But that goes along with everything we know about peer recovery support and lived experience.
Yes.
We just have such better outcomes. So yeah, I think you could definitely capture that with some good questions. And the other thing, somebody mentioned it in the chat, but one of the things that kind of differentiates evaluation from just like other things is that it's systematic. So, and to be systematic, it means that you're using kind of the same questions at the same
Okay.
point with the same people, and then you're able to kind of do this over time. And so there is a lot of value in using similar instruments for all populations, but then maybe analyzing those data or exploring them based on like, this is Allison. She had somebody in the harm reduction program who was actively using. This is what her experience was. The one thing that, and I'm kind of shifting gears, but everything it seems like in the chat and that people are focused on seems to be really quantitative, or like when we talk about what are the metrics, what are the measures, what are the indicators, what are the rates? I mean, you just kind of get into this narrative of counting. So I really think that stories would really be powerful. So interviews with those individuals to show like, this is what their experience was. This is what we learned. And there's different qualitative techniques that we've created that, and other people have too, that you could use. The other cool thing that folks are doing is putting those on their websites and on social media to really address stigma, to promote what you're doing in harm reduction. So I would think that would be really powerful too. I don't know if that's helpful or not, but what other questions do you have, Latanya?
I do have a question about, okay, so for so I live in a rural area of California. And I want to also try to get more, how would I approach people in the community more to come out to take the evaluations? Like, so, because we're like 86% Hispanic, but only 7% African American. We do have funds available to take the surveys and things like that, but what it would be a way to get buy-in from the community?
Well, and when you say community, are you wanting to and we just did this with Spotted Bull, one of our clients, but are you wanting to kind of collect perceptions about harm reduction
Or
and
just like not just harm reduction, but mental health in our area because, like I said, it's mostly Hispanic, low to no English speakers. We have a lot of Hmong people of Southeast Asian, and then it's mostly minority people. So how would I get buy-in for them to say, what services do you need? What services, what culturally responsive services do you feel you need?
Yeah, I think, there's lots of different ways to do that. One of the areas that we've had the biggest success is actually hiring people from those groups and
Mhm.
have championed the survey, the recruitment, social, depending on how you're collecting data, Facebook pages, anything LinkedIn, if you have a website, those
Okay.
can be really good. Be really careful with the bots though. We've had surveys where like bots have taken over and they've got 7,000 responses and there's only like 3,000 people in the community. So I think that that's something to think about. I guess I'd like to know a little bit more about the questions that you're asking, but just thinking about, we did a survey, and I have it up, I'll show it to you, with at a Wellbriety symposium
Mhm.
of our clients. And let me just make this bigger. But we wanted to know kind of their feedback about wellness and so we used Qualtrics, which is an online survey platform.
Mhm.
And we evaluated not just the symposium, but we also asked about cultural resilience, advice, so qualitative statements, their individual wellness and wellness needs. And so it really depends on kind of what you're wanting to have at the end. But there are ways to definitely make sure that it is responsive to what the community wants, what you want, and that people will provide meaningful data. And Lindsay, I see you've raised your hand, so I want to make sure we acknowledge that. And if you have something to share, we'd love to hear it.
Sure. I found because I work a lot with surveys in the community. I take churches or synagogues or whatever, like places of worship are usually a great place to start because so many people go in there, and if you can get buy-in from your community, places of worship, then that can kind of filter down to your whole community.
Oh, I love that.
Thank you, Lindsay.
That is a really good idea. And actually a student wrote about that with destigmatizing opioid addiction. So I think that's a great idea. And especially in different communities where faith-based communities are really attended well. So yeah, so Latanya, I hope that helps. If we had a little bit more time, we could probably dive in a little bit more. I'm happy to look at anything that you put together. The other thing I wanted to share was these are some resources that our team has developed, but there is a youth evaluation toolkit we created with Northern Cheyenne, and it actually has some really good examples. And I'll put this in the file that we share about how to kind of approach data collection in innovative kind of healing ways. And it talks a little bit about the steps, but then it also has some thoughts about how you create survey questions and really what you're wanting to ask. And I love the 5 whys method. And I don't have time to go over all this, but there's some good resources in this that might be useful to you. And maybe not, even on how you create surveys. And it sounds like, Shannon, that you all are going to have some other webinars on that. And so, yeah. Well, we have 4 minutes left, and I feel like the time went by really fast. And we're just kind of like at the very tip of the iceberg on thinking about value in healing spaces. So do you all have any questions or anything that maybe you really have to know before we end the call?
Thank you so much. I appreciate all of your input.
Yeah, thank you for joining. The one thing, Latanya, that I wanted to send you is, well, this is kind of a tangent, but we're ending, so so when I said to Shannon, yeah, I'll do this webinar, it was like, oh, great. And then she said, we'll pay you $400 if you do this. And I was like, oh, that's fine. And but I want to give that $400 to somebody that can use it for creating healing spaces and evaluation. So I thought we should give it to the person that volunteered. So Latanya, if you can send me your address, our team will send you that money, because that's how things work when you're working in healing spaces. So that sounds good. And Lindsay, you have your hand raised. So any thoughts from you?
Yeah, so I was gonna say one of the other things that I'm always like every time I take these surveys, right, from places that I go to and get services from, they're always like, well, were your services, did you receive wraparound services? Did all of your team talk to each other? Like really which drives me nuts, because how do I know if my team, like how do I know if they're talking to each other, right? Like I get asked these questions for programs that I don't like as a participant, that I mean, so when you're writing it, they make sense to you, but as a participant, they don't make sense at all. So I just caution to like really have input from your participants about the questions you're writing, because sometimes they make no sense.
No, that's a really good point. And, we like to pilot surveys. So that just means like you put a bunch of stuff together and then you ask folks who kind of represent the population you'll be surveying, do these make sense? And, a lot of times, like, that's the best feedback ever, because sometimes we create things that just do not make sense. But yeah, so it's really been nice meeting you all. I hope that you continue to find value in healing spaces. The trick is that we have to know our own value and know that we're sacred in the work we're doing. And that's where it all kind of begins and ends. So I just thank you for all the work you all are doing. I hope I get to learn more about it someday.
Thank you so much. I really appreciate
Thank
it.
you.
Yeah, thank you. And Latanya, we will be sending you that payment. I hope you do great things with it.
Thank you so much. Have a great day, everyone.
Take care.
Bye.
So if we have something that we created that we're interested to have, like maybe somebody look over, because I'm creating surveys for the University of Texas Health Houston, and like I've never done it before. So do you have could we maybe get input or something?
Yeah, I won't speak for you, Allison, but also anyone on this call, if you ever have specific questions about evaluations for your own program, for your own organization, you can submit a TA request with us. It's completely free. I'll throw the link in the chat. It's also on our website, top right-hand corner. It says submit TA request. We're happy to help with that. And yeah, sounds like Allison also.
Let us know. I mean, it takes a village. So we're all in this together. Nobody knows more than anybody else.
Well, and it's for the HRSA grant, which I don't know if it's a health HRSA grant. So it's a lot of questions and stuff that I haven't done that for. And I do tend to get very preachy. Like in my questions, I have to be real careful because I get very preachy, right? I'm like, I want to figure out if they enjoyed our program. And then I end up like, well, how is your supervisor doing with peer support? Because we don't, is your supervisor certified? Have they been in peer support? Like, it just gets into really preachy things, and it's not so much what we're focused on, but I get that overall. Like, I want to know how the field is doing, right? But that's not what I'm supposed to be doing.
That's one of the big lessons is that, I mean, we've spent so much time and money asking questions that just do not matter. And after 20 years, it's like, give me something meaningful. Yeah.
Or that's not what I'm supposed to be evaluating. Not what this evaluation is for. That's.
It's hard. A lot of funding agencies want you to count, how satisfied were you, or whatever. Yeah, I get it. But it's always a balance, right? Of figuring out like, how can you push the limits of what's legal and do good work and keep the funding? Yeah.
Thank you for your help.
Yeah, thank you, Lindsay, for
Bye.
Well, thank you, everyone. I'm going to go ahead and end the meeting, and I hope everyone has a great rest of their day. And Allison, thank you again so much for your presentation.
Oh, thank you all. Yeah, we'll see you all soon, I'm sure.